fellows already know how I'm going to start, but drugs are expensive. In fact, the average cost for ACT malaria treatment in rural Uganda, again, for a child, is 11 days of household income. So that might leave you wondering, why is that so expensive? Well, I want to tell you a story about I went to a pharmacy to observe their operations and learn more about our users. And it all started when I went to the customer area and sat down and observed. Eventually, the supplier came in this little taxi van here and dropped off all of these boxes in the middle of the customer area. The owner then turned to me and says, "Charles, you come and work." And so that's what I did. I went to the back and started doing inventory. The process is the following. Open up the box, you pick out one of these little drug boxes you see here, my mouse, and then you find it on the list. Then you can see the quantity, expiration date, and all that different information. So as an employee, all you do is confirm that the quantity is there, put a little check mark, and once you do that, the 3 pages of the list, you give it to the owner. The owner will then enter into the computer, item by item, line by line, as customers are coming in to do their inventory. At that moment, she tells me, I just pray that the power doesn't go off or else I lose all my progress. They use Tally, a business software, but not any version of Tally, a pirated version. And in fact, that's not a unique situation across rural Uganda. 90% of the pharmacies we visited in Bukedi and Kumi district use either a pirated version of QuickBooks or Tally. And that comes with a bunch of problems. Number one, no offline or online syncing and no backup when power goes out. This means that if power goes out, you just can't use your software, you can't log your sales. Then if you have 3 tellers and 3 people making sales at the same time, only one person has access to that computer, and it's a fully local version. So if you have multiple computers and multiple softwares, they don't communicate within each other. So you can't aggregate any of the data. Then it's incompatible with cybersecurity. If your computer decides to install a Windows update, you better hope it's not a security update, because then that can completely detect your software as a virus and crash your computer. And finally, if any of these problems happen to you and you need to contact whoever gave you that pirated software, you're going to contact someone who comes at his own price and on his own time. That can even take an entire month, something we saw in the community. And so this leads to inconsistent and unreliable sales and inventory data. So you might be wondering at this point, okay, that's great, but what does that have to do with decreasing prices? Well, in developed countries, they actually use drug data to optimize their stocking, and that led to a 55% decrease in inventory costs in Taiwan, a decrease that we hope can be passed on to the end consumers. And so that's why we're building Clinova. Clinova is an enterprise software built to address our users' challenges by doing the basic stuff, accounting, sales logging and tracking, and inventory management. But it also comes with some additional features that I'll talk about in just a second. First, though, I'll show you some of the mock-ups we made to get feedback in the community. So this is a desktop version here on the left, and this is a mobile version here on the right. This is probably not what it's going to look like at the end, but we use this to get very valuable feedback and guide our design. And this is where I talk about the features. So our customers will love us because we're reliable. We're using Wi-Fi direct technology paired with a mobile app. That means that if power goes out and you can't use your desktop computer or your laptop's battery dies, you can switch to your mobile app and continue logging your sales. When these devices are both powered on through Wi-Fi direct, the desktop is able to create a peer-to-peer connection with multiple devices in the vicinity to sync the data completely offline. No Wi-Fi connection, no paying for data. Then it's also time saving. So if you're an owner and you need to get information about one of your pharmacy branches, now instead of having to go there, you can call your employees and say, hey, can you back up the information on the cloud? I need to know something about sales today. And then they do it, it's there on your phone. But then what if you don't know that much about data analysis? That's why we're integrating a large language model like ChatGPT or Google Bard directly into our solution. That way you can just have a conversation with your data. You can type, what is my most profitable drug today? And it can directly give you an answer. No need to go play in spreadsheets. And furthermore, it's cheaper to use. We plan to price it according to the pirated version software, but also include customer service in our offer. So if something breaks, you don't have to pay out of pocket. And an example of how it could work, the supplier delivers the goods. Take your mobile app, you scan that printed list that the supplier gives you. You can then confirm the order contents directly on your phone, and it transfers inventory automatically. Then you log your sales, if power goes out, you switch devices. If you have multiple tellers, each log their sales on either smartphone, or if you have multiple computers, many computers, and then your analytics are available just by asking a question to the app.
Why Clinova and not QuickBooks? We offer cheaper prices, especially for multiple users, and we also offer multiple device compatibility. MyShamed is our biggest competitor because it offers a free software, but in Android version only. Now, our competitive advantage is that we offer both Android and desktop applications. So that means that the information and the data can sync easily, and all that at a cheaper cost. We use the subscription business model that has two types of packages. The basic package has sales tracking, inventory management, accounting and finance, cloud compatibility, and Wi-Fi direct. And all those features cost 10,000 shillings per month. And the premium package has computer vision, order recognition, and the large language model, and that is 30,000 shillings per month. According to our research, we discovered that the value for the total addressable market for enterprise software in Africa is $3.28 billion US. But we are focusing on East Africa that has East Africa that has a serviceable, obtainable market of $0.2 million per month. We are targeting pharmacies, drug shops, and private clinics.
Clinova is set to make a positive impact on both the environment and healthcare accessibility throughout rural Africa. We're aiming to aggregate community health data to then compare with climate models so that we can show the global warming's impact on health and disease spread. Offering real-time monitoring of healthcare spending to government bodies allows data-backed decision-making on healthcare initiatives. And then we're going to improve healthcare accessibility to individuals in the community through allowing them or giving them the option of checking drug prices ahead of time, ahead of going to the pharmacies and spending the extra money on transportation costs. Our team consists of Charles, who has experience in inventory management at GE. He's based in Canada. Sylvia, who is a monitoring and evaluation specialist, who's based in Uganda. Olga, a software engineer, also based in Uganda. And then myself, biomedical engineering student based in Canada. Within the two districts, Kumi and Bukadia, we interviewed multiple pharmacies, of which 70% expressed interest in testing our product once we have a trial.
Ladies and gentlemen, we have a mock-up that its development we hope to accomplish before the end of this year, and also have made registration for 240 basic or 80 premium subscribers in order for us to break even. In the long run, we want to incorporate suppliers to this platform so that pharmacists online. Also, we want to make prices available to the public so that they can know where it's cheap and go and buy from there. By 2026, that facilitates online transactions and payments. And by 2028, we want to have expanded to also other East African countries to benefit from our service. In order for us to implement our short-term goals, we need 15,000 US dollars, and 12,000 US dollars will be used to complete this product. 3,000 will be spent on marketing. In an effort for us to help local pharmacies thrive, we are aiming at strengthening the local economies and healthcare sectors in the rural areas. And we are actively seeking for strategic partners who share our enthusiasm to come and join us in this exciting journey to support us in whichever way is possible through connections, collaborations, partnerships, and funding. Thank you very much for audience.